Hello, my name is Yvette Hill. Today I'll be speaking about the elderly population that has diabetes. Table of contents. Facts related to diabetes. Impact on the community. Disease prevention. Role of the advanced practice nurse. Screening tests. Benefits versus harm of the screening. And at the end I'll be giving a summary. Introduction. I will define diabetes in the elderly population, provide facts and data on the elderly population that has diabetes, discuss the three levels of prevention and how the advanced practice nurse can address each level, explain activities from the clinical practice settings which clearly demonstrates the role of the advanced population health nurse, discuss potential unintended consequences of screening for the diabetes and weigh the benefits against potential harm. Benefits of diabetes. Diabetes, definition of diabetes. Diabetes is an ongoing disease that affects how the body turns food into energy. Most of the food that is eaten is broken down into glucose and released into the bloodstream. Diabetes is when there is not enough insulin or cells do not react to insulin. When there is too much blood sugar that remains in the bloodstream, it can produce serious health challenges such as heart problems, hypertension, kidney failure, and damage to the nerve and blood cells. Prevention. By keeping blood glucose, blood sugar under control, eating healthy, being physically active, and working with a healthcare provider can reduce someone's chances of developing diabetes. How diabetes affects the heart. Heart disease is the leading cause of death among the elderly who has diabetes. 70% of people with diabetes have high blood pressure. Diabetic kidney disease is when the cells and blood vessels in the kidneys are damaged because of too much sugar in the blood. Waste builds up in the blood instead of being excreted. This can lead to kidney failure. When the kidney fail, a person must start dialysis or must get a kidney transplant. High blood glucose can damage blood vessels that bring oxygen to the nerve and nerve coverings. Damaged nerves can lead to numbness, pain, and weakness in the hands, arms, and feet. An estimated 50% of those with diabetes has some form of neuropathy. The highest rates of neuropathy are among people who have had the disease for over 25 years. Here is a graph of the elderly population between the age of 65 and 74. Majority of the people who has diabetes are located in the southern region. Diabetic facts. A total of 30.3 million people have diabetes. That equals 9.4% of the U.S. population. 7.2 million people are undiagnosed. These are the people who are walking around who has diabetes and do not know they are diabetics. The total cost of diabetic and pre-diabetics in the U.S. is cost up to $322 billion yearly. The average price of insulin increased from 2002 to 2013 3 times as much. People who has diabetes have 2.3 times more medical costs than a person who does not. Here is a picture of the staggering cost of diabetes. Primary prevention. The primary prevention is keeping the disease from developing by removing the cause. For example, the primary prevention in diabetes is weight control. By a person keeping their weight at a normal body weight, it will decrease the chance of someone developing diabetes. Advanced practitioners at the primary prevention level, education is the key. Educating the patient that eating a well-balanced diet, exercise, and maintaining a healthy weight is just some of the things that a patient can do to help decrease their chances of developing diabetes. Advanced practitioners at the primary prevention level, that is the community setting, is educating the public about eating a well-balanced diet, exercising, and maintaining a healthy weight. Secondary prevention is detecting early disease when the disease is not showing any signs. A secondary prevention that could be checked in diabetics is checking for proteinuria. That's checking for protein in the urine. Advanced practitioners at the secondary prevention level, history taking has to do history taking and physical examination is the key. Asking if a patient drinks alcohol is an example of a history taking. A good example of physical examination is checking for proteinuria in a diabetic patient. Advanced practitioners at the secondary prevention level in a community setting will make sure that a patient will receive the proper test, for example, the laboratory test that checks for proteinuria and diabetics, but will also make sure that the patient will receive treatment for their diabetes. Territory prevention reduces complications after the disease has been diagnosed. A good example of this prevention in diabetics is regular ophthalmology exams, checking for the eyes. Routine foot care and monitoring for urine protein to guide use for androgens, converting enzyme inhibitors to prevent renal failure. Also, these exams help reduce the complication that diabetes can do. Advanced practitioners at the territory prevention level help prevent other chronic diseases, for example, cardiovascular disease or diabetic neuropathy. Advanced practitioners at the territory prevention level in the community setting. Advanced practitioners at the territory prevention level in the community setting will help prevent reduced complication of the disease that already exists by monitoring for foot care. If a patient comes into the clinic that is a diabetic, a foot exam and asking for the patient a few questions about their feet is a good example of this prevention level for the advanced practice nurse. The A1C test is a blood test that provides information about a person's average level of blood glucose over the past 3 months. The cost of the test averaged about $30. $30 could save someone's life. Here is a graph of the normal A1Cs in a normal person, diabetic, and a pre-diabetic. The benefits of screening for the A1C test for patients who might have diabetic is the cost of $30 compared to a person who does not get the screening for diabetes, and their cost will run up into the hundreds of thousands once a body part gets complicated. Summary. In closing, diabetes is an ongoing disease that affects how the body turns food into energy. Diabetes is a disease that can be prevented with a proper education by a patient changing their eating habits.